Dr. Henry, I'd like to ask you, if churches were able to put in the same safety protocols as bars, restaurants, and health clubs, what is it about churches or other religious gathering points that still make them more of a public health threat for the spread of the virus?
Yeah, so I think we need to look back on what we were seeing, and this is something that's not unique to this pandemic. We've seen it with other outbreaks as well, that the nature of the interaction, the social interaction that you have with a faith group is fundamentally different than some of the transactional relationships we have if we're going to a store or even going to, an individual working out in a gym, an individual going to a restaurant or with your small group of people. Having said that, we engaged very early with faith leaders across this province, and they recognize the important role that they play. I just want to reiterate, we know how important, essential faith services are for people and for communities across BC, and that's why we've been working with faith community leaders since March of last year. And we stopped all of those types of interactions when we were learning about this virus and what was happening with this virus and how it was transmitted and what situations it was being transmitted last March. And then when we reopened gatherings, and particularly faith gatherings, we did talk with the community about what were the things that made it safer. And those measures were in place. We limited numbers, we had spacing, we introduced masks when that was needed. We talked about the different things that happen in different, whether it's a church or a gurdwara or a temple or a synagogue, and tried to make rational approaches that would support people. We also know that there's a demographic that goes to many faith services and that is older and more at risk in some cases. So we needed to take that into account. And we were able to allow and to have active in-person services through most of the summer and into the fall. As with many other things, as we got into the respiratory season, we saw the transmissibility of the virus increasing. And what we were seeing was that there was transmission in a number of faith settings despite having those measures in place. So that spoke to us about there was something about those interactions that meant that the measures that we thought were working were no longer good enough to prevent transmission of the virus in its highly transmissible state during the winter respiratory season. And so it was because of that we put in additional measures to stop the in-person services starting at the end of November. It really was because we were seeing, despite people taking their best precautions, we were still seeing transmission. We were seeing people ending up in hospital, and sadly, we had some deaths in particularly older people who were exposed in their faith settings. I want to get back, and I've been talking with the faith leaders as soon as we can. Once we're out of that danger zone, once we understand what's happening with these variants, once we get our community levels low enough that it's not that risk anymore, then absolutely we will be going back to those safety precautions that we know work.
Follow-up, Richard?
You've mentioned over the last week a lot about Lunar New Year and Family Day, but there hasn't been a lot of mention about Valentine's Day. I know all social gatherings, there's restrictions on everything, I get that, but is there not any specific concerns associated with the way that people typically gather and celebrate on Valentine's Day?
Well, I will tell you that this is hearkening back to last year, but we have had some discussions with the restaurant and the food and beverage industry about Valentine's Day and about some of the concerns, but it's a fundamentally different vibe to Valentine's Day. It's generally couples, families, young people together, small groups. It's not a party in the same way that for the Super Bowl or, some of those events are. But again, we know this virus is transmitted when we have close contact with people. And this is a time to have close contact, to enjoy your Valentine's Day with your sweetheart, your loved one, and keep it small.